All right, welcome back to 12 News, everyone. Whooping cough is an illness that can spread easily. It's also called pertussis. An infection with bacteria causes it. So many people with the illness get a serious hacking cough. Breathing in after coughing often causes a high-pitched noise that sounds like a whoop. Dr. Quinn is here to explain more about it. All right, so what is whooping cough, Dr. Quinn?
Well, whooping cough is a very infectious bacterial infection. Is becoming more common. Unfortunately, we had a little bit of an outbreak last week where you all did a story. But basically, a patient that contracts this infection will present with a history of just uncontrollable coughing. Basically, they lose air. And what happens is when you get this infection, which is airborne, like the flu or COVID, which were viruses, but this is a bacteria, you get so much mucus buildup in your respiratory tract, including your lungs, some people can barely breathe. Like they'll come in, and then some people can become unoxygenated where they have periods where they don't breathe with all this coughing, and it can make the characteristic sound when they do take a breath. It's like, like that. And then they just keep doing that, and it's very characteristic. When I used to work in the emergency room, we used to see a lot of patients that came in like that. So basically, the treatment is an antibiotic because it's a bacterial infection, and it needs to be evaluated and treated very quickly because it can get worse, especially in compromised populations.
All right, so which demographic is the most vulnerable for whooping cough, you would say?
The most vulnerable, meaning the people that could have the worst consequences, which include pneumonia and or death, include the elderly, those with chronic respiratory syndromes such as asthma or COPD, and then infants, little babies. So that's why we have to be on the lookout. And if anybody is contagious or exposed, they need to go see their medical provider so they could be put on what's called prophylactic antibiotics. And usually that's just a Z-Pack.
Okay, so let's backtrack a little bit. How does whooping cough begin?
Basically, it's a respiratory infection. So if you're around someone with the infection and they are talking and you exchange respiratory droplets, then you can contract it. If your body is very strong, you could probably fight it off before it actually takes in, depending on your immune system. But if you start developing those symptoms, sometimes it might take 1 to 2 weeks. Then your body could be overcome with the infection, especially if you're somebody in the vulnerable population that we talked about, such as the elderly or those with chronic respiratory conditions, or even a baby. You could develop that coughing, can't breathe. That's when you need to go ahead and see your medical provider or go to the emergency room, especially if you can't breathe.